a member of the press for covering this, and I would also like to extend a warm welcome to all of you to this press briefing. Uh, we have had a one-day uh, expert group meeting on identifying research priorities and roadmap for understanding the declining fertility rates in Sikkim. As you all know, declining TFR is a matter of very serious concern for all of us, and the government has viewed this issue very, very seriously, and have taken certain initiatives to combat this problem also, which will be later you know presented to you before you by the chief secretary and the other speakers. uh, we have this is a joint collaboration between health department and planning department, uh, and with the support of the respected chief secretary, we have managed to take the first step towards really identifying the problems and trying to come up with credible solutions to combat this problem. So uh, now I would like to request Rohini Pradhan. She's the mission director for Sikkim Inspires, a World Bank project which the planning department is helming, uh, and she's looking after all these aspects in the planning department. So I would like to request Rohini to brief the press and media about today's program.
Like Sir said, so today we have this first historic meeting on identifying research priority and roadmap for the declining TFR in the state of Sikkim. As you all know, the TFR as of now, as per the NFHS data, is 1.1, which is even below the national average. And to talk about the World Bank project under which this study is going to be one of the result areas. So we are in the process, from the planning and development department, we are in the process of designing one proposed World Bank funded project which is called Sikkim Inspires. So under this Sikkim Inspires, we have around 9 priority departments, and one of the priority departments is, of course, Health and Family Welfare Department. And under Health and Family Welfare Department, we have identified two areas where we would like to have interventions under this program, Sikkim Inspires. One is the mental health scenario in the state, and another area where we are trying to sort of design interventions, targeted interventions, is maternal and child health. So, towards designing a targeted and meaningful intervention in this area, this was the first expert group consultation. So, we are very thankful to the help to ICMR, the Indian Council of Medical Research, which is the number one premier research organization in the country, and NIRSCH Mumbai, with whose help we were able to, sort of curate a very good list of experts who are here today for this day-long deliberations. We had representation from, of course, ICMR and NIRSCH Mumbai. We had the Population Council of India. We had AIMS and some very good private NGOs and organizations who have been working in the field of um, safe family planning practices, safe abortions, and all the related issues in the country for a long, long time. And I think it is general knowledge. We all know that when we talk about family planning in the country itself, uh, though it does have the term planning, uh, we understand family planning only in the scenario of birth control, right? We have only been talking about controlling the population, but and recently India also surpassed China, and we have become the number one populated country in the world itself. But when you look at the Sikkim scenario, we are in a way facing a demographic crisis where the projections from the health department, if the recent, the trend in decline in the TFR, if it continues, then a day will come by the turn of the century, maybe the indigenous Sikkimese population could go extinct. So it is as grim as that. So when we say that India is number one populated country in the world, so there are these pockets like maybe Bihar, UP, which are sort of compensating for the population contribution, right? But there are certain pockets in India itself, like in Northeast, some of the states are also showing similar decline in the demography. The population, the TFR is quite low, the decline is quite steep. So it is an area of concern for the state government, And also, we are very thankful to ICMR and also the Ministry of Health and Family Welfare. So, in the month of February, March, the Chief Secretary Sir had actually written a due letter. We had approached the Ministry of Health and Family Welfare and also the ICMR, and they have now issued an OM, Office Memorandum, wherein they have now identified this as a concern for the state, and they have now come up to support the state government in identifying the concern, the areas where we need to work on, and also the interventions that will have to be put in place. So, with this, I think I request the ICMR head, Madam Bharti Kulkarni, to take it forward.
And ICMR is committed to support the Sikkim government through research to find a solution to this critical reproductive health issue of declining fertility rate. ICMR's role in the current project will be to provide technical guidance for developing a research roadmap and conceptualizing and designing solution driven translational research. So, ICMR has 27 institutes in the country and a multidisciplinary team of scientists from ICMR headquarters, New Delhi, and a National Institute of Research in and Reproductive Health in Mumbai. Dr. Gitanjali Sachdev, Director NIRCH, is also here, as well as National Institute of Medical Statistics. So researchers from these three organizing these ICMR institutes will form a multidisciplinary team to provide the technical input for this research to identify the causes and then finding effective solutions for this critical issue. Thank you.
Now we'll take questions from the press.
So can you tell us how it would kickstart? I mean what are the priority areas which in fact Sikkim area inspires will be focusing on to carry out the study of the declining fertility rate? Mechanism to questions.
Uh, this is a very new area of research or policy intervention also. Like I said, the family planning policy scenario in the country itself is towards birth control. So here we are talking something, something like against the tide kind of thing. So this was the first research, the expert group meeting to sort of identify first to understand, because we do not have a very credible baseline also to base our study or research in the area. We are right now relying on the NFHS data, which is like for the entire country, this National Family Health Survey data is there. So we are relying on that data. We do not have any credible, on the ground data on the declining TFR in the state of Sikkim per se. So first thing I think would be to build a good baseline, and then we have come across many good suggestions on what the research papers should look like. So I think Madam can, if you could.
Allow me to.
Yeah.
The basic thing, as we have all known, I think we have deliberated, and for the last 5-6 months, when this declining fertility rate in this scheme was, I think, identified as one of the reasons for concern. So accordingly, I think various steps have been taken by the state government, which Rohini has already elaborated, that our communication to Ministry of Health and Family Welfare Secretary and then DG ICMR has finally culminated into this our first workshop, where all the we can say the brightest brain on the population control, infertility, and social scientists, experts from ICMR, All India Institute of Medical Sciences, Tata Institute of Social Services, IPAS, and so many other universities and experts. Total 21-22 experts were present together, most of them physically and some of them through online thing also. And the basic purpose is that we have the first thing which have been identified is that total fertility rate of Sikkim is declining. If we see from NFHS 2 onwards, from 2.5, 2.6, it has declined to the present level of 1.1. As you may be knowing that the replacement rate which has been approved is that 2.1 is the replacement rate when the population replaces itself, and our thing is a matter of concern because as per NFHS it has come down to 1.1. If it is, we further subdivide it into say urban and rural population. In the urban areas it has come down to 0.8 and rural areas 1.2. So it is an alarming situation, and if we believe the SRS conducted by our state officials, our TFR has come down to 0.8. I think for the press and media also, for another 5 to 10 years, unless this is reversed, it should be a burning topic for your editorials and your coverage also. Now, as Rohini has indicated, Dr. Bharti has also given in their thing that the reason has been identified, but it is not evidence based that what are the evidences or what are the causes of this thing. So now this a group of experts which are there, they will be doing their brainstorming session, questionnaires will be designed, and based on those things we will now our departmental workers, field workers will go into the field and they will collect data and identify the reasons that what may be thing, whether we have to do a community based analysis, whether the Bhutia Lepcha Nepali, the trend is true for everyone, or one particular community is having some specific problem which needs to be identified, and think if there are any genetic factors which are affecting this decline in fertility. Decline in fertility is a worldwide phenomenon. It is not that only Sikkim or India is suffering from this. Worldwide it is a phenomenon that the fertility rate is declining. But once it goes beyond the replacement level of 2.1, then it becomes a matter of concern, and we are almost halfway down of the replacement level. That is still a more reason for concern for us. Similarly, what is the economic status, why people are not having more children, whether they are avoiding because of their career enhancement or progression, or they are not able to sustain two or more child because of their economic status. These things also will have to be analyzed. The engagement of women in women workforce in government as well in private sector is increasing. So how we can provide child friendly work spaces in the office and the factories and other business places where the mothers can take their children, other things, those things need to be identified. As I said, the rural urban divide, this also needs to be studied, that whether it is specific to the urban areas or the rural areas also involved part of it. Similarly, socio-psychological study will also needs to be undertaken. So all these things based, it will create evidence, and based on evidences will be analyzed, and then we will be finding out what will be the right course of action for our future. In the morning, Dr. Lingdo had also presented a good study about the steps taken by the various countries. This phenomenon is also affecting other countries like Singapore, Japan, Korea, Hong Kong. In our Southeast Asian countries, they are thinking it had affected the Nordic countries like Norway, Sweden, European countries like Germany and other. They have reversed by certain interventions. They have bring it to a point where it is not alarming. So those studies will also be, I think, examined in the context of Sikkim, that what are the things which can be adopted by Sikkims and which can be sustained in the long run by the government support. So these are the basic thing, and this is our way forward for it. So today we had a day-long deliberation where I think on varied topics the thing presentations were made from our state government side also. Dr. Vandana had made a excellent presentation in the thing. I will also like Dr. Vandana to highlight some of the factors specific to Sikkim.
I'm looking after the fertility wing in STM Hospital. It was a brainstorming session since morning when we actually studied and looked into the various aspects of infertility from various points of view. Because infertility, we cannot say that we can actually just see it from the medical point of view. It's a socio-economic and cultural phenomena which has to be looked in a multidisciplinary area. So we're really thankful to the state government and also our CSR who's actually spearheading this mission because this problem was always there. The Sikkim was always below the replacement, the total fertility rate of Sikkim was always below the replacement level. But now it has become very great because right now it's reached 1.1. And actually, if we really look into the indigenous population of Sikkim that we are really concerned about, it has reached up to zero point 0.8. Now, when we actually talk about infertility, I think it is very important that awareness amongst the masses is also very, very important. Because now, due to this widespread thing of IVF, what people understand that if a patient is infertile, then they have to go for IVF. But there are various aspects that we have to look into because infertility itself is not just a one disease, it is a multifactorial phenomena in which we have to identify the cause why the patient is infertile. And when a patient is infertile, there's so many minimal treatment that we can actually start. Start with a basic investigation. Maybe they're having thyroid problem, both male and female. And here, what we feel is whenever a patient is infertile, we always tend to blame the entity or etiology on the female. So this has been a curse for the females because it was always looked that if a patient is infertile or if a family is infertile as such, we actually now we call it subfertile because when we call a patient infertile, we are telling that the patient will never be pregnant. But when we are telling that they're subfertile, means there is some factor that has to be looked into, and then they will be fertile again. So this is very important. So when a couple comes to us for treatment, it is very important that we have to look at them as a couple. That means either of them may be having a problem. The male may be having a problem, and the female may be having a problem. So we have to identify the risk factors that either of them may be having, and then start with the basic thing. That means we have to try to find out whether all the machines in the male is working and all the machines in the female is working, as we say in a very common scenario. Then if there's any problem that can be solved even with baseline investigation like thyroid, serum prolactin, or even like even let's say the semen parameters, which may be not below, just below the borderline level, we can treat it by simple measures. But then let's say right now, I think in Sikkim, with advancing age of marriage, we are actually suffering. Most of the cases of infertility is because of decreased ovarian reserve. So it is very important that awareness amongst the people regarding the declining fertility level when they postpone their age of delivering their first childbirth is very important both for males and females. So these are the various factors that we have to look into, and we have developed a performer with the Inspire team, which will be percolated amongst the masses because this will not be looking only at the urban areas. We have to reach amongst the masses who may be in the remotest of areas in north, west, so that we can identify who is actually facing the problem and give them solution in the best possible manner.
Uh, it has been explained before, so but I'd like to add a couple of points. See, the obvious reason is known to everybody, right? There are so many experts, and even common people can identify the obvious reason for the low TFR in the state. But there are not so obvious reasons which have to be unearthed, and then we have to find solutions, how to tackle these problems. So that is why this important meeting took place today. It was not just to sort of explain what TFR is and just to deliberate the obvious reason, but to find out what are the underlying reasons which has made the situation in Sikkim so bad actually. Because we share so many commonalities with other northeastern parts of the state, but it seems the northeastern states are faring a little better than us. I wouldn't say they are much better, but they're better than us. Of course, they are also facing the same problem. But in Sikkim, it has become so acute that the government had to introduce so many incentives and schemes to increase the TFR. For instance, you all know like recently the government announced special incentive, monetary incentive for the public also. In fact, for having the second child and the third child, a special monetary package is given. For government employees, the government provides increment. Earlier, it used to be increment for family planning, right? But now we have reversed the thing, and now government provides incentive in the form of increment to government employees for having the second child and third child. So the government has already taken these steps, considering the gravity of the situation. But the study is starting now, so we are hopeful that the study will come up with credible results and focus area for intervention. Thank you. Now, Dr. Sush.
Thank you. I would like to stress on IEC, Information, Education and Communication, which is a very essential program for any kind of programs that are being conducted in the country. So as you all as the media houses, you are the voices to take out the message of TFR right up from senior school to high secondary, to the colleges, to the community, to the administration, and you should be able to imbibe a political will in the state. And this is a very strong armament that you all have in invoking the message of decreasing TFR in the state. Unless we keep hammering this message to the people's brain, they will not register because their day-to-day life, their day-to-day struggle is more important than what we are perceiving as scientists and administrators. Thank you.
One more point, because why the state government is so much concerned about this. In the morning session, one of the doctors, Dr. Ranjan, she made a presentation, a specific presentation about the Khairwar tribe from Madhya Pradesh. Khairwar is a tribe in Siddhi district found in the Madhya Pradesh, and they also had this issue of reduced total fertility rate TFR, and today I think they are almost extinct. So with Sikkim, with the pace with which our TFR is reducing, maybe half a century will be a not, it will be a longish period. The early we may face the problems. So it is time that we are aware, we are alert, and we take all the necessary measures and steps to overcome it, to overturn it. And as I had told in beginning itself, the press and media has a very important role to play in it. Now, since you have also evidences and data that this is the thing of cause of concern, so I will like that you will keep publishing informed articles in consultation with the doctors or the international news reports and other things, so as to make the people aware of the thing in a simple, lucid language in which can be understandable to the people. We have identified some reasons, but that might not be based on evidences. These may be our assumptions, these may be our conclusion. That is why the expert groups have been engaged. Based on their research and study, they will give the reasons that these are the reasons which are leading to reduction in our TFR. I had said community analysis will be there, economic status, then urban rural study, socio psychological study. These may be some of the factors, but to pinpoint whether it is the genetic or whether it is the choice of the individual, this will come after the expert group gives their report in the next few months' time. Then only we can pinpoint that based on our evidence study, these are the reasons for the Sikkim which is leading to the reduced fertility rate, and how to tackle it, that also they will suggest measures, and then the steps will be taken by the government to tackle it. Basically, it is a societal problem, it has to be tackled by the society themselves, but whatever interventions are necessary and required to be taken by the government will definitely take them.
Everybody is aware, unlike we have seen a lot of Hindi movies, right? And the 60s and 70s, movies, of that era, the hero would be, carrying a bunch of papers, his credentials, and going to, look for a job, and then he will come back dejected, will not get the job. Do you mean to say because of unemployment, high unemployment, India's population has gone down? No. On the contrary, it has come up, it has increased. From 60s, 70s, you compare, the population has really gone up. Okay? So, coming back to the point, guaranteeing jobs, for your children is not the solution. Like somebody else was raising this issue, there are obvious reasons which everybody knows. For instance, women's empowerment is one reason, right? As you are empowered, you make choices. You make life choices for yourself. Okay? You defer marriage. You marry late. You are more concerned about your career. Okay? You look for your career. If you marry late, obviously there will be problems. Besides medical issues. Medical issues, Dr. Bandana has already explained. The non-medical issues are like this. I'm like, these are the non-medical issues. You are right. There are socio-economic issues, and come to your point earlier. Everybody used to have a big family, right? How did it decline? Why did it decline? We are discussing that only basically. See, it is a matter of choice actually, right? It is a matter of choice. Nobody prevented me from not having too many babies. Nobody prevented. I mean, there are certain, section of the society who can afford to have larger family size, right? But they are not exercising that option because of the other underlying factors. Like for instance, women's empowerment, like I was mentioning, and your career choices. Okay, so these are the main issues. Now, as far as jobs and security, social security is concerned, the government is fully equipped. At the present moment only, the government is providing jobs, employment to a huge number of people. The government is providing employment, mark my word, to a huge number of people, and there's no problem as such. Qualified people, people who are highly qualified people don't go begging for jobs. Yeah? They get jobs. Okay. So as far as creating jobs and social security is concerned, the government is ready. The government has the means to do it, and they are doing it. Now, we have to really find out what is the real cause, what is the real issue behind this low TFR. That is why we have convened this, we have taken this first step in trying to understand the issues which are not visible to everybody. Okay? So it will take a couple of months to come up with findings. Brainstorming will happen even after today's session also, because we'll be in constant touch with the experts, and as we go along, we will come up with some credible solutions which then the government can implement. In fact, at the cost of repeating myself, I've already explained the government has already taken major steps which all these big, wealthy nations, European nations have taken also. And we didn't take these steps in consultation with them. We took it so more on our own. Okay? The chief minister announced these, steps on his own. Actually, he did not consult the government of Norway or the government of Sweden on how this scheme is doing. We thought like these are the incentives which might prompt people to going for a larger family size. So the government is very, very serious about it, and please don't worry about the future of the newborn children or the unborn children. They'll be taken care of. We are a very vibrant society. We have a very good economy. They'll be taken care of. So there's hardly any link between the future prospect of a child, unborn child, to the low fertility rate.
Yeah, my last question is with
Now,
to the
this
Secretary, sir.
madam's question,
Oh,
this job and fertility. If you see the data of NFHS 2-3, when our TFR was more than 2.5, 2.6, then there were not more than 10 to 12,000 persons in government job. Today, our fertility rate has gone down to 1.1 as per NFHS and 0.8 as per SRS, and we have almost a lakh of persons in government jobs. So there is no correlation between job and TFR. The question is that, as we all know, that earlier it was I think the percentage or level of employment among women was less. Now it is more, and because of their career progression and other things, they may not like to have more children, because staying on leave for a year or so, they may become unwanted in their organization. and this is also leading to the one of the reasons, maybe our scientists and doctors will come out with the thing, that small family size. Earlier when we were having our joint family with father, mother, auntie, uncle, puppu, chachi, koko, kaki, koko, unchati, then when the child was born and how it grew, even the father, mother were not fully aware of it, because so many hands were there to take care of them. Now they're staying alone with wife and husband, and then if both of you are going to office, who will think? This is maybe one of the reasons for the working women to avoid having more number of children. So there might be other so many factors and other things. These are all conjunctures we are making. Whatever we are saying is not based on evidences. We are saying on our day-to-day observations and other things.
Yeah, I would like to help you out by setting my own example. I am in a private sector. I'm not in a condition to give birth to a two child, although I'm not married yet now, next year. So I guess if I'm able to give birth, I will just give birth to one because I'm not in a status to give birth to two child. And government providing me 5,000 per month won't help me. Nowadays expenses are growing so high, I won't be able to do that. So I think this is the one reason I've given setting my own example. I think this will help you.
No, this is the thing which we discussed in the morning in one of our deliberations, that the increasing cost of children education, the health services being to be provided for children, these are all increasing day by day, and that may be, I think, little bit uncomfortable on the pockets of the parents there. So we had deliberated on one of the aspects in the morning, and the idea is to find out the ways and means that how we can subsidize or increase on the education, health services and other things, so that the parents should not deter for having more children. And once, I think, we wish once you are married, you will, I think, belie your own statement which you have made today.
I would just like to add one thing about this big family size earlier. Uh, Everybody knows Sikkim, for that matter, the entire country used to be an agrarian society where everybody was a farmer. The service sector was not there. Service sector was also very limited. So during those days, a big family used to mean more hands to work the field, right? So the more number of children you have, the wealthier you were actually, because there was no such thing as hiring, people for work, paying them for work, and all those things. So the more number of children you had, the more hands you had to till the farm, and more income you would get, more richer you would become. But with changing times, when people have changed their occupation, now the service sector and the government sector provides more employment to people. So with this scenario also, maybe the requirement for more number of hands, to support the family is not there anymore. So this can be one of the reasons, from a big family size to a small family size.
Get all the credible news on the go. Download the Sikkim Chronicle app.